In this presentation, I will talk about the tooth scaling and root planing step-by-step procedure. First of all, guys, I want you to know that this procedure is indicated for all patients with 5 millimeters and more periodontal probing depths. And the procedure is summarized by doing these 5 steps. Step number 1 is to take the dental and medical histories from the patient with a quick exam of the dentition. In this situation, I want to concentrate on two diseases, which are the uncontrolled diabetes mellitus or uncontrolled blood disease, for example, a hemophilia or uncontrolled hypertension, because these diseases will lead to the happening of some bleeding problems and healing problems. And after doing the diagnostic procedure, we will anesthetize the teeth to be scaled and root planed, and it is advised here to start with the lower anterior teeth so that your back muscles will stretch and adapt to the procedure, because the procedure may take a long time. The third step is to remove the supra and subgingival plaque and calculus with hand scalers first, and then with Cavitron or with Cavitron only. And that is by starting from the interdental papilla, plaque, and calculus, and break the other parts of it, the plaque and calculus areas. And also, the root planing procedure is done by repetitive pulling strokes on the root surface. After that, the plaque and calculus are removed and the root surface is plain from any unwanted tissues. The most common areas that you will face the plaque and calculus deposits on are the lower anterior lingual surfaces and the upper posterior buccal surfaces, because they are the surfaces that are located opposing to the major salivary gland ducts. After doing that, you should check your uh, work, and that is by the use of a mirror and the 1112 probe. Using mirror is of major importance in this situation, because you cannot sit under the tongue of the patient and see the aspect of the teeth from that view, so that it is very important to use the mirrors always during your checking procedure after the scaling and root planing procedure. After that, you should provide the patient with the oral hygiene instructions based on his habits and your findings, and then dismiss the patient. Um, your assistant should schedule an evaluation appointment in 4 to 6 weeks to check the plaque deposits amount and the commitment of the patient to your oral hygiene instructions. You should check the bleeding and the gingival condition, and you should check the clinical attachment level and the periodontal condition. That was the summary for the scaling and root planing procedure. Here I want you to have some notes about that procedure. For sensitive teeth, you may use the alternative manner. I mean, you come to the area and clean it, then leave it, and come back and leave it, and come back and leave it. That will decrease the sensitivity for the sensitive teeth. Also, you can decrease the vibration power of the Gavitron and anesthetize the patient correctly. That will decrease the sensitivity. Or simply by using the manual scaling instruments, that will also decrease the sensitivity to the patient. Note number 2 is how to use the Cavitron. First of all, I want you to know that the motion of the Cavitron tip is by putting it vertically, or as you can see here in the lower left picture, you can put it vertically and move it backward and forward on the patient's tooth, or horizontally and moving it upwards and downwards on the patient's tooth. And by the use of the size of the tip of the cavitron only, not the tip of that tip. Okay, the angle is 45 degrees to the tooth surface, and the power is preferably medium, and the water should be in a fast drops with water spray manner, as you can see here in the lower right picture. As you can see here in the lower right picture, there is a fast drops with a mist of water or a water spray. This is the correct amount and picture for the water of the cavitron. Thank you for this nano construction of the world by listening to this presentation. Always try to know, spread knowledge, and construct the world. Be kind to one another because life is not short but it is limited, and that is for the greatest benefit to the humankind.